Good afternoon all, this is Dr. Vedavati, Specialist Pediatrician. Today let's learn regarding vitamin D supplementation in babies. So we say we need to give vitamin D as soon as they are discharged from the hospital from the routine newborn care, and to continue till the age of 1 year. This is the WHO recommended guideline. But many parents will have a lot of doubts regarding the same, because sunlight exposure should produce vitamin D. Why should we supplement? And the mother is also breastfeeding, why it should be supplemented externally? So many things. So coming back to the question, why we should supplement? Because when the baby is in the mother's home, mother will be supplementing the baby with the vitamin D adequate doses, and as soon as the baby is born, that vitamin D supplementation from the mother side will be cut off, and whatever storage the baby has, it is not even sufficient for 1 month of his birth. So the supplementation becomes important. And secondly, even in the breastfeeding mother, the amount of vitamin D in the breast milk going to the baby is also very negligible. And coming back to the sunlight exposure, sunlight exposure can produce vitamin D in babies, but then it also depends on the wavelength and the time you are exposing this baby to the sunlight and the duration of exposure, which is practically not possible to do. So in order to avoid all that, we can routinely supplement. Why it is important? Because once vitamin D is deficient, the vitamin D dependent electrolytes like calcium and phosphates, their function will also get affected. As a result of it, we see a lot of changes in the babies, like soft bone disease, what we call rickets, where this long bones or growing bones will get affected, and we see small swelling near the wrist or over the ribs, and at times we see frontal bossing, knee changes. And as the baby grows, their milestone, gross motor, like sitting, standing, neck holding, all these milestones will start getting delayed. And secondly, it's also important for the nerve functions. So sometimes when the vitamin D is very low, it affects the function of calcium also and absorption of calcium also. So as a result, we see sometimes hypocalcemic seizures, or it's a form of fits where it improves with the calcium supplementation and vitamin D supplementation. So that we see. And in children with vitamin D deficiency, we also see a lot of respiratory infections, recurrent on and off we are seeing. So other than that, there are many other hypotheses regarding vitamin D supplementation and its importance. Let's not discuss that at this point of time. Main thing to remember in infants is it affects the bone health as well as the respiratory health and as well as the nerve function. So it's very, very important to supplement the babies with vitamin D. So then coming back to the guidelines, how much we should give, till what age we should give. So the minimum recommendation from WHO and CDC is when the baby is born, it's being started on supplementation with vitamin D, that is 400 international unit, or from day 1 to till 1 year of age. And wherever the case where the sunlight exposure is less or outdoor activity is less for the children, from 1 to 2 years we can supplement them with 600 international units also. So this is regarding the basic recommendation of vitamin D. If any further queries are there, you can always discuss with us during the consultation. And at times, wherever we find this soft bone disease or rickets, or there are recurrent respiratory infections or unexplained myalgia in children, we might consider doing vitamin D levels and other calcium phosphate levels, which is regarding the bone health. So which will be discussed in detail during the consultation. Any further queries, you can always discuss with us. Thank you so much.